Hey Vinny, what's up? This is my steroid assignment. My assignment's on discussing the potential positive and negative psychological effects of anabolic steroid use, using book and peer-reviewed literature to support each viewpoint. Good afternoon, classmates, Vinny and Patrick. Today I'm going to be discussing the potential negative and positive psychological effects of anabolic steroid use. So I think the best way to start would be to explain what a steroid is. Anabolic steroids are drugs which are derived from testosterone, which is a male hormone. Some are in tablet form and others are injected into the muscle. There are many different types of steroids: andriol, halotestin, proviron, sustanon, primobolan, and decadurobolan, just to name a few. Now that we have a good idea of what steroids are, let's discuss the risks that people undertake when they take steroids. The use of steroids encompasses a lot of negative side effects such as aggressiveness, heart problems, and shrinkage of the testes, acne, and high cholesterol levels. H.M. Perry and G.W. Hughes took a closer look at some of the psychological side effects of steroids. A case study shows a general practitioner requesting a psychiatric evaluation on a 30-year-old man known to be taking anabolic steroids for bodybuilding. The patient presented with severe acute depression with suicidal effects after the purchase and injection of Haldol decanoate. The patient then went on to tell his GP that he had taken Periacetin to suppress his appetite. Unfortunately for the patient, even after he was prescribed with procyclidine and daycare was initiated, he continued to suffer from depression and suicidal thoughts for some 9 months. Out of the psychological side effects of stacking steroids with other drugs, suicidal thoughts is one of the worst. Although steroid abuse has numerous negative side effects, they are still quite common across many age groups. A study done by Winston R. and Dimitri D. on the prevalence of anabolic steroids in 5 male and female high school students found some interesting results. 5.9% of all students out of about 1,300 reported using steroids. Taking into account the fact that steroids are an illegal drug, and yet 5.9% of high school students openly admit to doing them, it can be said that some students believe steroids to have more overall benefits than negative effects. Because of the way they work, it is rather easy to gain the appearance most people would consider ideal. This, as well as other psychological factors such as more self-confidence and a more outgoing attitude, are some of the few reasons steroids are becoming increasingly used at younger ages. So, it is important for us to have a complete understanding of what the misuse of steroids can lead to. A study was done by Yesela C.E. and Barkley M.S. that aimed at evaluating the acute effects of anabolic steroids on normal male volunteers. Out of the relatively small sample of 20 males, one of the men experienced an acute manic episode which represented a 5% increase even under very stable conditions. Considering the subjects were taking 240 milligrams of methyl testosterone, an amount a lot of doctors consider to be safe, it can be said that steroids can be very harmful even in small doses. However, steroids can't be all bad, otherwise why would people openly admit to taking them when they are illegal? Let's have a look at some of the benefits you can get from anabolic steroids. Anabolic steroids have a lot of appealing positive effects, such as increased leanness and muscle definition, increased muscle mass, increased effectiveness of training, increased recovery weights, as well as an increase in sex drive. Depending on the amount of steroids you take and where you inject them or apply them, they take different effects. Dr. Lamb developed a study to test effects of steroids on lean body mass and musculature throughout the body. On the tested individuals, a bare minimum gain of 2.2 kilograms of lean body mass was observed. However, due to the nature of steroids, as well as taking into account things such as genetics and what exercise regime you are personally undertaking, effects of use are very individualized. Because of the positive effects of steroids, that they are often associated with professional sport, as athletes take them to stay on par with other athletes who would otherwise gain an edge. Steroids are prevalent in almost every sport, whether it is baseball or NFL, bodybuilding or rugby league. An interesting study done by Boston on 61 men aged 18 to 35 who were instructed not to exercise over a 20-week period and were given 20 milligrams, 50 milligrams, 125 milligrams, 300 milligrams, and 600 milligrams of testosterone split evenly up between the groups, testosterone and Nentheth weekly. A lot of positive effects were observed in the 300 milligram dosages. Muscle size significantly increased whilst fat mass went down. Steroids can have a good positive effect both physically and mentally when taken in controlled circumstances. We're just going to have a quick look at a video on steroids in sport and how much of a difference they can make. So I'll probably get you to click on the link now. It's in my Word document. And after you watch that, we'll go ahead and move on. In conclusion, steroids can cause a lot of problems for the public because people are naturally greedy and take more than the recommended amounts, as well as combining them with other drugs and stacking. However, the positive benefits you get from steroids, physically and psychologically, cannot be ignored, and neither can steroids' prevalence in professional sport. The changes steroids can make are often extraordinary and can be a very good way of dealing with a lot of problems such as obesity or strengthening muscles and building them. Whilst the use of steroids remains controversial, if it's used in the right setting and amount, then you're going to get a lot more benefits than negatives. Thanks for watching.